Hi there, welcome to Headway Physio. We're really glad you're here. If you're watching this, congratulations, you've already taken the first big step forward into understanding and overcoming this area of your body. TMJ disorders for too long have been misunderstood and misdiagnosed. And maybe you've had neck pain, back pain, shoulder pain, jaw pain, and you're not sure where it's all coming from and you've been looking for answers and you haven't gotten any. We are so passionate in this area of the body, and we're so excited to begin working with you.
Most healthcare professionals, even incredibly skilled ones, receive shockingly little training on TMJ disorders. In fact, medical and physical therapy schools usually dedicate just under a week to this entire region. And until 2024, dental programs weren't even required to include it in their curriculum. So if you've been bounced between providers without answers, you're not alone. You're not crazy, and you're definitely in the right place now. While the best recent studies suggest TMJ disorders are the largest reason for orofacial pain, we also know that nearly 25% of these cases are truly dental in origin. So, number one rule, always check in with your dentist first. If your dentist says your teeth are fine, but you still have pain, that's where we come in.
Under the umbrella term TMD, or temporomandibular disorder, there are 12 diagnoses that we are looking for in our exam, and none of them are treated exactly the same. This is why we don't jump into a treatment plan on day one. We do a selected intervention based off the findings from our examination and your history, and then when you return after about a week or two, you will let us know whether or not the intervention was testing the theories and they actually helped change your reason for coming in the first place. Now we have an actual treatment we can begin with.
What makes Headway Physio unique is that you are at the center of this process. Once we identify what's going on and treatments that work, our goal is to teach you how to manage it and ultimately treat it yourself. That skill set and watching you move on without needing us anymore. That's our end game.
Now, a few things to prepare for your first visit. You should have already received the intake forms. Please take the time to fill these out. Tell us the story. Tell us what's going on, what you've been dealing with. The more time you take now, the less time we will have to spend on chatting through these things in our first session, and we can spend more time examining. Really think about your goals in the intake form. What does success from this experience look like to you? Is it chewing? Is it not having pain, less headaches? Really try to understand why we're beginning this process, and that will help us shape our treatment around those goals. Please bring any night guards in, any night splints that your dentist has made, as well as provide us the dentist's information so that we can send reports out and communicate with them to better serve you.
Our first session will include manual therapy and potentially dry needling if appropriate and with your consent. Think of these two things as hardware resets for your body. Dry needling can help us with our diagnosis, treating pain that's being referred from one muscle group to another. It's a really powerful tool for things like myofascial pain, especially when it's referred from the head and neck into the face. But if needles aren't your thing, no problem, we've got plenty of other options. Then comes your home program, what we call the software reset. This is delivered via a user-friendly app that includes movement retraining, education on anatomy and pain neuroscience, techniques to improve awareness and control of your jaw, as well as strengthening and mobility exercises. This is what keeps you from landing back on our table over and over again. It's the key to lasting relief.
Here's the deal. We commit 100% to this process, and we ask that you do too. Most patients experience about 4 to 6 visits under our care. We are big proponents of not booking patients 10 to 20 visits at the first day arbitrarily. We don't know what you need until we see. Every case is different. For more acute cases, like locking of the jaw closed, we might recommend you come in twice a week for a few weeks to get on top of it. For things that are more chronic in nature, we might recommend you come in for a few weeks once a week, and then quickly shift you down to a program that you can manage yourself, checking in when you need us. Look, TMJ patients are often left to fend for themselves. That ends now. We are here to support you through this process, teach you everything we know, help you understand what's going on with your body, and ultimately learn how to take the reins yourself. Should conservative care not be enough, we have networks of dentists, orofacial pain specialists, and surgeons that just do TMJ surgeries. Should you ever require those things or imaging, we would refer you to the appropriate place. This is not something you have to go through on your own from this day forward. We're excited to work with you, and I can't wait to begin.